All right, Bob and our viewers, we will show you a quick step-by-step, safe and proper use of the inversion table. This is for beginners or a review, or if you're using it and you can't figure out if you're doing it right or not. We'll show you.
Let's get to it.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, number one, Bob, make sure that you get this cleared with your doctor first, particularly if you've had any joint replacements, heart conditions, eye problems.
Right.
Those are precautions that you do not want to invert your body to go through, so make sure that's clear. We're not going to go through the details on this video. Okay, the first thing you want to do after you have your inversion table assembled and everything is the way it needs to be per the instructions, is we need to set the height. Now we're using a teeter table, and this is per their instructions. They're all pretty similar, but there may be differences. But you need to adjust the height that matches your body. I'm 5'10". I'm going to look on this bar right here. I can pull this out and move this up and down, and I'm going to set it for 5'10".
And it's got numbers in metric and in English.
Right. Now this is not precise. You're going to put it to your height, and then you have to test it, and we're going to show you that in just a little bit. So here I am. I'm locked in, and we'll go to the next step.
That's the slide bar.
Okay, Bob, before you even get on your unit, make sure that the limitation or the safety strap is adjusted properly. Now, they can vary, but I would not go more than 60 degrees. You don't have to measure it exactly, but that's about even with the back brace pull here. And you may actually want to adjust it, which you can here, so it goes maybe
Only
about
that far.
45 to start out with.
It can go 90, right?
Right. If you don't have this on, complete inversion will occur. They're made for that. However,
we don't recommend.
Particularly if it's the first time on, for sure. Okay. Okay. Now, this may or may not be the case on all tables, but there's actually a foot or an ankle setting where you rotate this 180 degrees. And what that does, it positions your ankle in the proper position. These cushions should come down on the narrowest part of your ankle. So for example, on this one, if I rotate it this way, it moves my foot up about an inch.
Closer?
Yep. When I pull this lock and goes down, the pressure is on the top of my foot, which is not the right location.
So you need to rotate back down, right?
Exactly, Bob. So I'm going to go like that, and I know this because I've practiced with this one, and now I know it locks in on the small part of my ankle, the padded area, and that's what you want.
So it's one or the other.
Right. And again, look at your specific table and see if that option's available. You really want to make sure it's into your ankles well, for obvious reasons. Number 5, once you're secured into your ankles, you'll want to just lean back and take your time with this.
Give it a little test.
Yep. Go to the horizontal position, and with you relaxed, you should feel very confident that you're balancing here. It's kind of like a level.
Right.
If you move your hands up towards your nose or your face, you should slowly go back with good control. If you put your hands this way, you can get level. When you want to go all the way up, you simply go like that. You do not want to have to depend on the handles for pulling and pushing yourself up. If you do, you're not adjusted in the proper spot.
Brad, makes look easy, but it does take some practice, right?
You know, you adjust your body in here and just play with it, and it may take you, a few minutes or a couple times to get comfortable, but you need to get comfortable and relaxed, otherwise the unit won't be effective. Okay, Bob, next, I feel very comfortable here. I'm relaxed. I can control myself. Yep. And now I'm going to go back and start the initial traction or decompression. I'm back to here, and I feel pretty comfortable. I'm going to go back up to here. I'm going to go back to here. I'm going to go further. I'm going to bring my hands back. Whoa, this feels weird. I'm going to come back up. And just do this a few times until you can go all the way back and you're back to position. Now, if you get back and you can grab these bars right here, then and I'm pulling against the strap is stopping me. That's a good home base, if you will. And I may hang out here for 20 seconds. I can feel blood going to my head Nothing unusual, no unusual pain, no
No
dizziness.
right?
However, if your eyes feel funny, you get dizziness, or anything that's
Nauseated.
not comfortable, get yourself back up to this position. Okay? Now, if you do that, 0 symptoms, I would go back with a timer and a partner. You're not going to do this by yourself the
Right.
first time. Go back. Okay, I'm going to get back to here. Timer's on.
For how long, Brad?
1 minute to start with.
Gotcha.
Okay? 0 symptoms. Even if it feels good, you're going to stop at 1 minute.
Right. This is the first day one.
Yep. And get up to here. See how your back feels. See how things are going. And actually get yourself
Get out
Yeah.
and walk around a little bit.
and assess your back. If you're
Right.
having pain down the leg, see how that feels. If you inverted and things felt better and the pain down your leg improved, good
Good
sign.
thing,
Yep.
yep.
Then you get up and see if it stays better with weight brain. Sometimes it changes, and that's okay.
Right.
The big thing is you don't want it to get worse once you get up and
Right.
walking around. If that's the case, then you're not going to use this. You may come back the next day
Well, you
and
don't
try
want
it
to feel
again.
worse on here either.
Yeah, exactly. So one thing with this, you may do it one day, the first day or two, and it may not make it worse, but it may not make it better. If that's the case, it feels the same. Keep working with it.
Right.
You may have to work with it a week before you get those discs and vertebrae
Really
to
learn to
separate.
relax your abdomen.
Exactly right,
The
Bob.
full effect.
That is really a key. Okay, so you're on there for 20 seconds. You got up, walked around. Everything either did not get
You're on
worse.
there for a minute.
Oh, I'm sorry.
Right.
Thanks, Bob, for correcting my memory. And you got up, you walked around. Everything either got better or no change. Then you can get back on and continue your
Right. For how long, Brad?
maximum of 5 minutes.
Gotcha.
Now, I wouldn't do that the first day
First day,
for
right.
sure. Maybe 2 or 3 days into it, you can progress a minute.
First day, maybe 2 minutes.
Yep.
Right.
The next day, go to 3 minutes. Max out.
Slow.
Yeah, max out
Right.
at 5 minutes. So you'll be hanging back here. Now, Bob, you want to
We
talk
want to make
about
this point that it's really important to relax when you're on the machine. That's how you get the full effect. Really relax your midsection.
Yep. So if my stomach is tight, and you might have tight core muscles without even being aware of it, just because you're anxious, you're uncomfortable in an upside
Right.
down position. But after you get used to it by the 3rd or 4th day or whatever, so everyone's different, then relax.
Right. As you become more comfortable with it, you'll be able to relax more.
And now I am relaxed, and I can definitely feel my spine getting a little more traction.
Elongating.
Yep, and it feels good. It feels very relaxed. I'm happy with it. Again, no more than 5 minutes. No more. You need to stop any kind of negative symptoms, dizziness, pain, or whatever. And we'll come back
Up
up.
you go.
There we go. All right. Now, I do want to mention you will find on the internet and some sites and channels where they talk about full inversion,
Right.
all the way upside
90
down.
degrees.
Yep.
Right.
And what happens there is it'll go like this and you're hanging upside down. We do not
Right.
promote that
We
at
don't
all.
recommend it.
Some people do it and they have success with
Right.
it, so they claim, but it's pretty aggressive.
And you get adequate traction at 60 degrees.
Exactly, as far as your spine. The other thing that we do not promote is when you're tilting back is twisting
Right.
of the spine. We just want straight, direct traction as we had demonstrated.
Yep.
So good luck with your inversion table. Take it step by step. Be safe, be careful, and good luck again.
Be cool.
Yeah, be cool. I'm cool, Bob.
Yeah,
I
I'm
remember.
sure you
I remember
are.
when cool wasn't cool.
Really?
Oh, that was a long time ago.
Oh,